Thank you very much, and thank you to Designs for Health, University of Bridgeport, Dr. David Brady. And David, thank you especially for letting me not follow Jeff Bland. And thank you, Jeff. That's probably the slowest I've ever seen you speak. But everyone needs a mentor, and I think he's been a mentor to all of us. I don't have any slides. I just have a message. We all knew about Dean Ornish's work, that heart disease is reversible, right? Some of you are doing it. You know Alzheimer's disease is reversible, right? Before we leave this weekend, you're going to see that it is, how to assess people, how to address it, and how to reverse it. There's a new paradigm in this. It's using functional medicine and assessing the entire person, their timeline, their matrix, their bioterrain. All of the tools we're taught in functional medicine, all of the tools of all of the collaborative care people in this room. For me, and I'm an MD, whether you're an MD, a ND, a DO, a DC, a nutritionist, a registered dietitian, a health coach, there's no ego here. We're all on the same team. It's a collaborative care team. We need each other. We need this entire collaborative care team to crack the code on this incredible illness of dementia in our world. 30% of people, if they live to age 75, will have dementia. It kills 1 in 3 people over age 80. But it's not just the burden of Alzheimer's disease, it's the caregiver burden of Alzheimer's disease. Been working for about 10 years trying to crack this, and now the tools are available, and the data is coming out that it actually works. One of my first patients was a rancher wife. They'd been to their doctor, they got the world-class dementia evaluation called a CBC, a chemistry, a TSH, an old-fashioned syphilis test called RPR. She didn't even get an MRI, and she got the 1-page, 10-minute mini mental status exam paper test. Really? Is that what you would use to assess your irritable bowel patient, your chronic migraineur, your autoimmune patient? Why would you not look at their functional genetics? Why would you not look at their microbiome? Why would you not look at their nutritional deficiencies, their hormone imbalances, their toxicity? How come we haven't put that lens on cognitive impairment? Well, now we are, and guess what? It works. What we're finding is that if you have severe Alzheimer's, and I'll share this with you tomorrow, those folks are very difficult. I kind of think of it as a hill. If you're so far down the hill, the energy to pull you back is almost impossible. But if you've just started down that hill, or you're on the top of the hill, we very successfully, 70 to 80% of the time, can pull you back over. And what I see is once we get them out of cognitive impairment, early dementia, we keep them there. The plan works, and it's sustainable. When they go off the plan, they step down. When they go back on it, they get back up, but never to that same point, and it takes a little longer. When they step down again, it takes a little longer, and they never get back to that same point. But this is reversible. And the burden of Alzheimer's disease, the burden on the caregivers, is really where we have to work as this collaborative care team with the MD, the ND, the DC, the health coach, the nutritionist, the exercise trainer. We're all in this together, and that's what the key is. Every person in this room has a story, right? There's a reason we're all here. Either traditional medicine failed us, someone we loved, or someone in our family, or we found this medicine for someone we loved or someone in our family, and it worked for them. That's what brought us here. Everybody in this room will have a story if we shared it with you. Let me share a little bit about mine, and maybe you'll get some pearls from that that'll help you, especially as I ask you at the end of this day to become a mentor for someone else. I was 7 years old. My family took me to Cape Canaveral for my birthday. I saw the big Saturn rocket go off. A week later, I saw Neil Armstrong walk on the moon. I said, that's going to be me. So I studied math, was the #1 math student in Nebraska, got a ROTC scholarship out of high school, flew to Corvallis, Oregon. They picked me up in a Jeep, went to the submarine base, because you had to be a nuclear propulsion expert then to become an astronaut. They put me on a sub. We stayed underwater for 2 weeks. That didn't work for me. We promptly surfaced, went back to dock. I hitchhiked back to Nebraska, completely lost. Went to Central America fly fishing, spent 3 months there. And I met a woman whose boat broke down that I fixed for her, and she told me she had lupus. And no treatment in the States helped her. But she'd found this medicine man in Belize, and her lupus was in remission. So she took me there. And I met this 102-year-old Mayan healer priest who knew something about natural medicine we've never learned, that there's an energy to plants, that there's a signature in plants. The plant in nature will show you what it's used for. There's a bark that looks like burnt skin. If you make a poultice, it's the best thing for burnt skin. So I spent 3 weeks with him, and I came back to the US, was having dinner with my father, who was chairman of psychiatry, completely lost, not sure what to do because I wasn't going to the moon. And I told him about this healer priest, and he thought that was very interesting. He was into orthomolecular medicine, was a friend of Linus Pauling's. And we opened the paper in Omaha, Nebraska, and guess who's on the front page? This Caucasian cardiologist with the largest afro I've ever seen in my life. All you could see in the picture was a fro. It was Dean Ornish. He came to Omaha and said, I'm going to find 100 men who've had heart attacks, are scheduled for 3 or 4 vessel bypass. They're going to have their chest cracked and their veins stripped out of their legs to redo the plumbing. And I'm going to tell them to not do it. I'm going to teach them how to eat, how to exercise, how to deal with stress, how to find love and support in their life. And they're going to do better. My dad said, this guy's crazy, you better go meet him. So I went to the hospital. He took me to the doctor's lounge where they had the doctor cafeteria food. They had the Dean Ornish food. He took me to lunch. I went right to his food. He said, I've been here 2 weeks. You're the first person to eat off that bar. So I was his research technician, and I saw these transformations. Now, there are already 3 doctors in my family, and that's the last thing I wanted to do, but something changed that day. And I saw this happen, and it was really the social support that was the most powerful medicine he had, because in those social groups that had to meet every week, some of them would go bowling together and go to movies and make dinner together. Those are the people in the subgroup analysis who did the best. So you don't need medication. You don't need surgery. The most important thing you need is love and support. So I fast forward. I went back to school, decided to go into medicine. But I wanted to know everything they don't teach you, because my first day of med school, the chancellor said, we're going to spend 4 years teaching everything we know. At the end of the 4 years, half of what we taught you will be wrong. Your job is to figure out which half. So I went into internal medicine because they taught me when you hear hoofbeats, think of horses. But if you go into internal medicine, you better know all the zebras. And so I wanted that level of training, but I got naturopathics, osteopathics, homeopathy, Ayurvedic, Chinese medicine, acupuncture. I'm not great at any of them, but I get it. So when I talk to Dr. Nalini, we can talk in the same language and be the hub of that wheel for people. When I was doing my master's, I tried to create a Dean Ornish team for Alzheimer's. So we got some private funding. We could only do 1 day a week. We had a geriatric physician who's an internal medicine doctor that specializes in the elderly. We had a geriatric psychiatrist. We had a psychopharmacologist. We had a nutritionist, a physical therapist, and a social worker. We would all interview the family, and you couldn't come by yourself. You had to bring your whole family. And at the end of the day, remember the old overhead projector? We would write out the treatment plan on the overhead projector. And we had much better success. But I was doing PET scan research with Tacrin, one of the drugs that treats acetylcholinesterase for Alzheimer's. I didn't see hardly any change in these PET scans. The drug got approved. And what do you see clinically? Doesn't really do much. Why? This idea of monotherapy will never work for Alzheimer's disease. How about HIV? Did monotherapy work for that? No, it wasn't until they got the triple drug therapy. Now we're pretty successful for it. So the analogy I use is as you look at a complex entity like cognitive impairment, dementia, Alzheimer's, it's kind of like the 36 holes in the roof. You can have one really good patch, but your roof still leaks. So you've got to look at the genetics, the microbiome, the nutritional deficiencies, the hormone imbalance, the toxicity. You've got to look at the entire bioterrain. And if you shift the bioterrain, you shift the dementia. And this is what the protocol that Dale Bredesen has put out. We just got done teaching last weekend for the Institute for Functional Medicine, 250 doctors, on this protocol. And at the beginning, I asked that question. How many of you think this is reversible? Just a couple hands went up, because there's people who've been doing this like us for a while. After 18 hours of intense training, I asked the same question. There was a roar in the room. And what I'm going to teach you is the 5 subtypes that we categorize Alzheimer's into. Number 1 is inflammatory. Those are things you're really good at, right? You can do inflammation. Number 2 is trophic. That's lack of vitamin D, lack of hormones, high insulin affecting your hormone balance. Number 3 is this concept of toxic, whether it's mercury toxicity, biotoxin illness from Lyme or from mold. Number 4 is vascular. That's the mini strokes, the multi-infarct dementia. Number 5 is this epidemic of head trauma, traumatic brain injury. But nobody has only one subtype. So when you leave tomorrow, you're going to be able to see a person with cognitive impairment. You're going to know how to evaluate them. You're going to know how to assess their bioterrain. You're going to be able to subdivide them into 5 subtypes, because no one has one. Everyone has a little bit of several. And know how to address and assess and have success with cognitive impairment. As I flew here last night, I walked through the airport. I looked down at the newsstand. There's a Scientific American. What's on the cover? Did anybody see it? First success in Alzheimer's. It's the Finnish study called the FINGER study. I can't remember what that all stands for. I just know it's the Finnish study. But they took 1,200 people, broke them into 2 groups. One group had standard health care. The other group focused on exercise, nutrition, brain games, all the things we're talking about here in this reversing dementia paradigm. And they had a marked improvement. And these are people who were screened to be at risk for cognitive impairment. So again, the lifestyle part of the matrix, the bioterrain, the way you're assessing these patients, and the tools that all of you have in this room. Yes, it needs to be food. Let food be your medicine, kitchen be your pharmacy. But you need targeted nutraceuticals. As much as I don't like to think that toxins have a big hold, because I'm not a toxin expert, it's a huge problem. You listen to the work of Joe Pizzorno in toxicity, you look at this epidemic of Lyme disease, you look at this very interesting concept of CIRS, which is C-I-R-S. That's the mold toxicity, which I don't even want to go there, but I got dragged kicking and screaming a couple years ago, because there's people that all of the tools of functional medicine didn't fix, but this did. So there's a concept called inhalational Alzheimer's disease. These are these people, they're typically younger, they're not the genetic subtypes we see in traditional dementia, and their lives are non-existent, and they have the brain findings exactly like we see in patients with Alzheimer's. When we were doing the PET scans for Tacrin, we were looking at amyloid and changes in metabolic blood flow. Guess what? I think amyloid might be good. So this whole model of medicine we're going after amyloid might be completely wrong. And an easy way to think about this is, you guys are good at treating osteoporosis, right? You give 1 or 2 bisphosphonates and call it a day. No, you look at the gut, you look at the bioterrain, you look at vitamin D, you look at the right kind of calcium, balance of magnesium, you look at copper toxicity, you look at all of these other things that affect those 2 cells called osteoblasts, osteoclasts. The blast builds bone, the clast tears it down. It's that simple. So what we want to do is support the good girls and calm down the bad girls. So for the brain, it's the same way. What the brain does in the Institute for Functional Medicine annual conference this June, everybody in this room should come. It's on neurodegeneration and plasticity. It's going to be a game changer for neurodegenerative disease, for Alzheimer's, for Parkinson's. What the brain does is it prunes itself. And it's kind of like a CEO of a big corporation that looks at everything underneath them and decides whether we should go or no go for the next year. Should I continue on this plan, or should we shut the company down? So at that synapse level where the 2 nerves talk to each other, all of this information gets summed for the synapse to say, let's grow or stay where we are, or let's pull back. And the amyloid may be a protective mechanism in that. So it's like the osteoblast, osteoclast. You have a synaptoblast and a synaptoclast, but it's not one cell, it's a whole host of triggers that gives a go, no-go signal to the brain cells. And that's where this protocol with the 36 holes in the roof, that's really what it's trying to do. And it's doing it on the setting of what your genetic basis is. We all know about ApoE4. There's a 2, a 3, and a 4. Those are the genes that predispose you to Alzheimer's. Well, guess what? The ApoE4 is relatively new for us in Alzheimer's. It might actually have been a protective mechanism, because 1 million years ago, Everybody had it. That's all that was there. Because back then, we wanted to be reactive to our environment. If you ate a parasite, if you got a dirty stick punged into your arm, you wanted to have this immune activation, so it jumped on this right away and made all these inflammatory cytokines and all this inflammatory storm to fight the bug, to activate the immune system to get rid of that challenge. It was a fight or flight mechanism. But that has evolved with us, and some people with this ApoE4, they still have that response in the brain. And it may be this innate immune system of the brain spinning over and over and over. I don't know about you, but when I was in med school, they told me the brain doesn't even talk to the immune system. It just kind of sits there. It sits there up in the head. It's a little black box. You got a couple TV channels. It doesn't really do anything. It has no interaction with the rest of the body. Well, guess what? It's got its own immune system, and it talks in part and parcel with the rest of your immune system. So what happens in one area happens in another. If you would bear with me, sit back, relax. Like I said, no slides, nothing to memorize. But sit back, relax, and close your eyes for a moment. What I want you to do is focus on one of your patients that's had heart disease. And let your vision go to that heart. Take the fantastic voyage into the blood vessel. See their plaque, see the endothelial lining, see that irritation, that inflammation, all those inflammatory markers we're learning about, CRP, myeloperoxidase, plaque 2, all those fancy words. It's the fire in the blood vessel. Now take your focus and bring it up to the brain. And I want you to see that same fire in those blood vessels. Then also see the brain tissue shrunk down. Then see a bruising on the front of the brain. And then see a little poison circulating through. So when I talk about the 5 subtypes, the first subtype is the inflammation. That's that fire in the blood vessel. The second type is the trophic, or the lack of growth stimulation to the tissue. That's the atrophy you see. The head injury, concussion, traumatic brain injury, that's the bruise you see on the front. And the little poison you see floating around is the biotoxin from mold, Lyme, or other heavy metals. You just became an expert in diagnosing Alzheimer's disease. And then we'll teach you tomorrow all the tools you need to assess and address each one of those subtypes. Thank you very much.